I grew up in the suburbs of Baltimore until I was 13, so being able to return here for fellowship and continue to stay on as faculty has been incredibly rewarding because of the opportunity to give back to the community of Baltimore, which I gained so much from growing up in my childhood. My name's Alexandra Forrest. I'm a maternal-fetal medicine physician and an assistant professor in the Department of Gynecology and Obstetrics at the Johns Hopkins School of Medicine. Both of my parents are physicians, so I grew up in a household where I was exposed to the joy and the importance of helping others. So it was no surprise that I went into medicine, and then I specifically became interested in maternal-fetal medicine because of the unique ability to work with patients on their journey to building their family, which I would argue is one of the most important times in their lives. I think a really important lens that I bring to patient care beyond just being a physician is that of a mother. I have my own family, and I found that that role specifically helps enrich and strengthen the relationships that I have with patients over the course of their 9 months of pregnancy. My clinical and research interests in maternal-fetal medicine are relatively broad. I see patients in the prenatal clinic, in the ultrasound unit reviewing their scans, and I deliver babies on labor and delivery. I have an interest in all high-risk pregnancies, but a specific interest in cardio-obstetrics, which is the care of women who have heart conditions diagnosed at the time of birth or later in their life. One of the really unique parts of working at Johns Hopkins is the interdisciplinary care between physicians. Over the course of my time here thus far, I've been able to form really strong relationships with members of the NICU, with members of cardiology, and other subspecialties. And together we can form a team to take care of both mom and baby and ensure the safest possible outcome.